Hello, everyone. Welcome to Career Pathways with Adeola Kagho. This is the podcast where we bring you real stories, honest reflections, and transformative insights to help you navigate your careers with courage, clarity, and purpose. This is episode 2, and this particular episode excites me a lot because of my guest today. My guest today is somebody I met a year ago at a point in my life that I was very vulnerable because my daughter was undergoing a bone marrow transplant in India. And just watching his team provide world class care with commitment to what they do every day left such a lasting impression on me. And I am very sure that not only people in the medical field, but people from all walks of life will benefit from the wisdom and the insights that he'll be sharing with us today. So if you're ready to grow, to lead, and to thrive, then you are in the right place. All right. Our guest is Dr. Satya Prakash Yadav. I hope I've pronounced your name well, Dr. Yadav. I'm very honored to have you here. You're welcome.
Yeah. Thank you, Adeola. And it was wonderful to be guest here on this wonderful initiative podcast, Career Pathways. And yes, my name is correctly pronounced. Thank you.
Thank you so much. So I'm going to start by reading your profile so that our guests know or our audience know the caliber of person we have here today. All right. Dr. Satya Prakash Yadav is a world-class pediatric haematologist-oncologist with over 25 years of experience treating childhood blood disorders and cancers. He's globally recognized for his expertise in bone marrow transplantation, having led hundreds of successful procedures for conditions such as leukemia, thalassemia, and sickle cell disease. Trained in India and Australia, Dr. Yadav is also a respected researcher, educator, and mentor with numerous publications to his name. He holds leadership positions with numerous within key national and international pediatric oncology bodies, where he contributes to advancing care standards, training, and research. His career is defined by clinical excellence, compassionate care, and a deep commitment to making life saving treatments more accessible to children around the world. And that's something that I can actually validate from my time in India. So, again, welcome, Dr. Yadav.
Thank you for inviting me. And it's wonderful to be here. And I'm excited to talk to you. So, yes, go ahead. Thank you.
Thank you. Looking forward to a very enriching conversation. Okay, so let's get to the very beginning. Could you tell us how you made the decision to study medicine? What influenced that decision?
Yeah. So that's a very great question, in fact. So when I was in school, so I think in year 7 or 8, class 8 or 7 or 8. So at that time, I got interested into science and it really intrigued me, science as a subject. And I always thought that how life started and how these things happen. So I picked up a book in our library, school library. It was called Life, and it
Wow.
described right from the start how life started on Earth. So it described that it started in sea, in oceans, this life started. And they were the first bacteria which were there, one-celled organisms. And they slowly evolved to multicellular and then various like animals in sea. Then they came on land and then rest is history. We all know. So the most intriguing chapter in that book was that even for the bacteria, they need to function and how they function.
Mm.
And that was the most exciting thing, that from certain chemicals, we made DNA, deoxynucleic acid, DNA, which has a genetic code. And this genetic code gives instructions to make proteins. And proteins are
Wow.
life. Proteins make muscles, protein make cells, protein make all the structures in our body, our skin, hair, everything is made of proteins. So that is given by, this instruction is given by the DNA to make those proteins. And these proteins control chemical reactions. So they control for the cells need energy. So they have to burn glucose with oxygen. So we breathe, the oxygen goes, we eat food, the glucose goes, but they have to react, and this reaction has to be controlled to generate energy. So the proteins control this. These are the enzymes which control the reaction, and we get ATP, which is the energy currency, which gives us energy to the cells, and then they can do a lot of things. So, and when there is extra energy, like there is extra glucose, we eat too much food, then for a bad day, it is saved as a fat. It is converted into fat and it is stored. And when we don't get food, the fat is burned to carbohydrate, converted back into carbohydrate, and we can use it to make energy. So it is so intriguing and wonderful. When I read this book at such a young age, I thought, wow, this is so exciting. Human body, cells, bacteria, and life in general. Such a complicated thing has happened on earth. We human beings and all the living things, they are actually living, and these are started from something which was not living. It's just chemical reactions, chemical bonding, and how DNA got made, and it led to rest of things. So it is super exciting, and that led my interest to biology. And I pursued biology as a major in after my high school. So once you finish year 10, then you have to choose a stream. So in year 11, I picked up biology as a major and physics, chemistry, and mathematics. So all science subjects I kept and studied. And my elder brother, he's like father figure to me. So he told me that you have to become a doctor, because there is no doctor in the area where you are born. We come from a small town near Delhi where there were not many doctors in that area. The health services were very poor, and he said that if you can become a doctor and serve all these people, that would be wonderful. So anyway, I had interest in biology and always, and his guidance and inspiration and the need of our people, I decided that yes, I want to enter medicine and become a doctor. And then after year 12, there is an entrance exam, and which you have to write. It's a competitive exam. Clear that, and I got into medicine, a medical school, finished my MBBS, and rest is history. So I'm a doctor and working in India and saving lives. Yeah.
Fantastic. And it's interesting to note that, it was through reading a book.
Yes.
And I mean, even when you were describing what you read in the book today, it was very obvious that you have so much passion for life. I also did pick up that there were some needs within your community, and also the fact that there was sort of family influence as well. So somebody who sort of guided you. So a combination of all those then led you to the medical career. And you also did have the aptitude because you had to pass an exam, because even if your uncle had asked you to do it and you couldn't
Yes.
pass it, then it wouldn't have been easy. So great. Thank you for that. So, Dr. Yadav, if you look at the world today, the world has changed a lot. In fact, there are programs in Nigeria that I have listened to that is advising people not to even go into medicine any longer because of how the world is becoming really disruptive, where technology is taking over things. And so, my question to you is, if you had to make this decision again, knowing what you know today about the world of work and what you've experienced in your medical career, would you still choose the same, and
So
why?
the answer is very straightforward. Yes, it would be medicine every time I have to
Oh,
choose a profession, because there is nothing bigger than saving a life, and
mm,
or comforting someone suffering. A human being who is suffering from a disease and is unable to take care of himself. And if you can make a change in his life, or there is a deadly disease he's suffering from, and you can cure him from that, improve his quality of life, and give him a life, long life. So I think no profession comes close to it, that kind of thing. So I see children whom I have treated for cancer, leukemia, or for sickle cell disease, or for thalassemia, or children born without immune system. I have cured them with bone marrow transplant.
wow.
And when I see them after 10 years, 15 years, 20 years, and they are grown into beautiful young people who are working independently, enjoying life, and they have forgotten me because they were very small. They were 2 year old, 3 year old, 4 year old. They don't even remember. When they come, the parents tell, he's your doctor. They said, oh, who is he? So why we are in a hospital to meet him? So the parents keep on telling stories, but they can't connect with me. But I feel so proud and happy that, wow, what a magic that medicine treatment what a difference it has made in the lives of these children and the families, because once it's an entire family. When someone is suffering, the whole family is suffering. So yes,
Absolutely.
happiness, that smile
Absolutely.
is wonderful, and nothing can equal that. And there are setbacks, yes, we sometimes lose patients, and that's a huge suffering also.
Mm.
And when we lose someone, it affects us a lot. So it's not for a faint hearted. Medicine is something, this branch is for people who are stronger emotionally and have a huge emotional quotient, but nothing wonderful than curing someone. Nothing can come close to it. Yes.
Yeah. I mean, it's clear that for you it's really about the purpose and saving lives, and nothing is going to change that for you. And it's good to know that there are still people like you who are committed to saving lives on a daily basis. So thank you for what you do, Dr. Yadav. So, if you are not going to change from medicine, but also just understanding how things are changing, how technology is impacting everything in the world, if you were advising people trying to make decisions around their career, are there specific areas in medicine that you will then ask them to perhaps start focusing on?
Yeah. Great question. So, medicine is vast, and there are so many areas of medicine which are there, and you can pick and choose what you want to eventually do in medicine. So you can specialize, you can super specialize, you can focus on certain area like heart, cancer, or your skin, or anything, any area, psychiatry, mental illnesses. So you can just decide what you want to do, because each thing needs a lot of passion and a lot of
Mm,
study and a lot of learning and experience to take care of the patients. So, and then technology. So, technology is coming in a big way in medicine, like in all other aspects of life. And it is making, I take it in a positive way, it is making life better for our patients, for the doctors. And it is a helpful tool. It's not a challenge, it is helping us to do things faster, efficiently, in a better way, and cure more people in a shorter time. So I'll give you an example like CAR T cell therapy. This is something new which has come in cancer. So, what is a CAR? It is a chimeric antigen receptor, CAR. And these are the T cells. T cells are there to take care of our immune system. They fight the viruses and protect us from infections, T lymphocytes. So, when you get cancer, and the cancer is not responding to any treatment. So, there was a girl called Emily Whitehead in US who had blood cancer, and she couldn't be cured of by chemotherapy and bone marrow transplant. The cancer still came back, and the
wow.
doctors had virtually said there's no cure available known in medical science, and we can't treat her. So the father said that, is there any research going on, is there anything new the doctors are planning or doing, researchers are doing to cure cancer? So he was told that there is one doctor, Professor Carl June in University of Pennsylvania, who has a new treatment, and he's done it in mice, it's successful, and he can cure cancer. You can meet him. The father went to him, and Professor Carl June said, yes, I can do, I have a treatment, but I don't have funding, money to start this clinical research, this research trial. So the family helped fundraising, money was raised, and the trial started, and their daughter was the first patient on that clinical trial. So what they did, they took out her T lymphocytes, her immune cells in the lab,
Mm,
and then with the help of a virus, it changed the genetic code of that cell so that it could express a new receptor on its surface, a new receptor which could attach to the cancer cells and then could kill the cancer. T cells kill the bacteria or virus, so they could kill the cancer. So they developed these new T cells, CAR T cells, and put back into Emily Whitehead's blood, and they went inside, and within 24 hours she got high fever, very high fever, and they
wow.
thought that she's something is wrong with her, there's some reaction to these cells and something. And then she dropped her blood pressure, she landed up in ICU, was very critical, needed ventilator, and everyone thought that things are all going south. They are not, it's something hugely wrong. And then they thought, they checked some chemicals, so there was some inflammation. The new cells were fighting with the cancer, releasing a lot of chemicals which was causing this drop in blood pressure and breathing difficulty. So it could be blocked with a medicine, tocilizumab, which could block those chemicals. Interleukin 6 was the chemical. So that injection was given, and the patient within 24 hours improved and was out of ventilator within 48 hours, out of ICU, and she was very well. And then they checked for the cancer. The cancer was gone. There was no cancer
Wow.
after 48
Wow.
hours. And now it's 12 years since she got the treatment. She's still free of cancer. She was the first patient who got this treatment, CAR T cell therapy. Now more than 10,000 people around the world have got it in last 12 years, and they're cured of refractory cancer, which anyone would have written off that you are incurable, nothing can happen. So that's how medical science is progressing, and new things are happening. Technology is helping us, like gene therapy. We're using viruses, we're using genetic code, we're using a lot of AI in medicine, which is helping us develop new treatments. So this is just one example. A lot of things are happening. Gene therapy for sickle cell is again product of AI and computers and everything. That how we can change the genetic code in sickle cell bone marrow and fix it and put that sickle cell new bone marrow back into the patient. You don't need a donor. Like your daughter had a transplant from someone else, but
Yep.
we can take out your own bone marrow and change its genetic code and fix the sickle cell problem and put these cells back, and that's known as gene therapy for sickle cell disease, and that's something which in future would be easily available, and then possibly bone marrow transplant may not be required. So this is
Yeah.
something, a lot of things are changing. Yeah.
So what I'm hearing you say is there is a lot of technology helping in medicine today, but if people were to make choices, passion is still important. So look at the area that you are passionate about.
Other than the medicine, they can go into biotechnology, where technology is used
Biotechnology.
to make treatment, and bioinformatics, where computers are used, AI is used to look at the genetic code. They can go into microbiology, where they study
Okay.
bacteria, virus. So a lot of other ancillary branches are there which help medicine. They can go into physics and design CT scan, MRI machines, and those are other things. So biomedical engineering, that's, they are engineers who build all the things for the hospitals. So a lot of things are there which where technology is coming, and a lot of other newer branches or newer professions are coming, where hospitals need not just doctors, they need a lot of technical people to run these big hospitals.
So those are areas that professionals should begin to start considering as the world of work
Absolutely.
evolves. Thank you for those recommendations. Okay, so Dr. Yadav,
Yes.
did you school in India? Could you tell us a bit about your educational background in medicine? Where did you study?
So I studied in Delhi. So I did my MBBS, that's becoming a doctor. That's the basic degree you need. So it's a 5.5 years program, where you study for 4.5 years, and then 1 year is internship, where you actually treat patients, but you are being monitored, you are being trained. So that's how after that you get your degree, and then you can practice medicine as a general physician and look after all the patients. And then after finishing my MBBS, I decided that I want to specialize in pediatrics. I want to treat children only. And so for that, there is a 3 year program, which I did, another degree, 3 year training, and learned all about how to treat children and their disorders in great detail. And I became a pediatrician, a child specialist. And
Yeah.
after doing that, I specialized further in blood and cancer disorders. Yeah.
Yeah. So the reason why I
But I,
ask about where you study, the reason why I ask about where you studied is the fact that professionals nowadays are under pressure to attend Ivy League schools or globally elite schools. And looking at someone like you who has been successful, I just want you to shed some light. How important is this kind of consideration, especially in your field?
yeah. So, like Ivy League, we all know these are the top schools in USA who are very, very famous and very elite people, or people who pass out go to the, like, they're considered elite people. So it's difficult to get into those schools, but it's not like the only thing in the world. So in the end, results matter, not the path you have taken to reach that the final destination. So if you want to enter a particular, you want to become a professional or train into something like a doctor, and you want, so it doesn't matter which medical school you went to or which college you, that's not very important. Yes, it is important. A good school always helps you, but it's not end of the world if you don't go to Ivy League. You can still study. you have to acquire skills. And even if you go to the best of the schools and you don't study hard, or you don't work hard, or you don't learn the things, you don't have the passion, you would never achieve something great, and you won't never make a huge difference. So there are a lot of people who have come from very humble backgrounds and they have achieved the top of the tops, like American President Barack Obama. So he studied in very small schools and landed up in a lot of became president of America. Like Indian Prime Minister, he has a very humble background and he's running such a big country. Ultimately you have to acquire skills. So if you can acquire skills and show the results to the world, people will be happy and they'll recognize you. It doesn't matter which college or school you come from. Those things are secondary and least important. They are not the main thing in life. The main thing is that eventually what you do and how you serve the community and what you can provide to people. That's the most important.
Yeah, great, great. So in medicine, you do not think that it's really important. It is good. I mean, if you can't get into those schools and you can afford it, it is good. But if you cannot, well, it's not the end of the world. What's important is the passion you put in and your output at the end of the day. All right, that clarifies it. But in the world of work within your field, are people who didn't go to all those globally elite schools, is there any bias against them that you've noticed in any way?
So there's no bias like that. And people who have this sort of thinking have small thinking. Their
Mm,
vision is, so you have to have a bigger vision. Ultimately, when you are working and doing good work, that is recognized by all the people. Like as you have said, that when you met me, you didn't not impressed by where I train. You were impressed by the work we do, and that was the
absolutely.
most important. And that's what mattered, and that's what eventually is there in any profession. If you're doing your job good and helping work in a team and help everyone grow, then that's the ultimate goal of doing that profession. But if you are not a
Mm.
team person and you're just thinking about yourself and not really updated yourself, you're not really don't have the skills, you won't go very far. Even if you come from the best of the schools, people won't recognize you. People won't say, you may get a head start with a good college background, that maybe you're ahead of others, maybe for a few months or a couple of years. But life is a long journey and it doesn't matter.
I think you make an extremely valid point there where you've said, look, even if you have that Ivy League education, if you do not continue to improve yourself and stay on top of the trends, then at some point you may still become irrelevant. So yeah, that's such a valid point. During our conversation, you had mentioned that you decided to specialize in pediatrics and then eventually in blood cancers. And not just in medicine, across so many other fields, people struggle making decisions around whether to remain generalists or to deepen their expertise in a certain area. So how did you make that decision? What guided that choice and what would you recommend for professionals?
Very interesting question. And so it all depends on what you like and what your background is and where you want to work. So if you want to serve a lot of people and want to, or in a smaller city where there are not many doctors, so there the general physicians are the most important. They are the lifesavers. They treat all kinds of disorders. So a general physician is someone who is jack of all trades, master of none.
Yeah.
So they can manage everything, but they're not specialists. So if you need highly
Mm,
specialized treatment, they will refer you to a specialized center. But they will save your life. They will provide you basic treatment. And when in an area where there is no doctor at all, so they are saviors. They save lives. They are the community doctors. So like a country like India, 1.4 billion people, and it's huge country. So physicians, general physicians are the most important people. They serve the major population of India. So if you want to serve a lot of people and make difference in their lives, then general physician is the best way, and stay like you do MBBS and maybe specialize in general in community medicine and serve the community at large. But if you are working in a bigger city or in specialized hospital, bigger hospitals, there the work is divided. So if
yeah.
someone has a cancer or cardiac issue, they will go to that department and get treatment there. So the role of general physician is less in bigger cities or bigger hospitals. And so there you find being general physician as boring. you have no work to do.
Mm.
So you have to specialize in bigger cities. So like I trained in Delhi, and I was aiming to settle in Delhi or this area, and I thought that I have to specialize. And I liked pediatrics, so I thought treating children is something which intrigued me, I was passionate about, and that's why I trained in that. And then children's blood and cancer disorder was, I saw that children in India suffering from blood cancer or thalassemia or sickle cell not getting proper treatment or not getting bone marrow
Wow.
transplants and other things. So I thought, okay, I need to learn this because this is lacking in India. This is not there, so I have to train. And that's why finally I opted to train and super specialize in this branch in pediatric hematology oncology. That's what I did.
So it appears to me that your decision was shaped by the need to serve your community.
Yes.
These were real needs in your community, and you
Yes.
made yourself available to study this.
You have to put your hand up.
And what I'm also taking away is it looks as if what you're saying is that even if you decide to be a generalist, you can still lead a very meaningful life and serve so many people, especially in countries like yours and mine with very huge population.
True.
Okay, thank you. Dr. Adav, when I was doing my research about you, I did find that at some point you were in Australia. So I'm not very sure if that was for education or for work, but what is clear is that you had some international exposure. And so I would like to first understand when and why you took that move and how it has shaped your mindset and your approach to your profession.
So you're right. I trained in Australia in Sydney. I did my fellowship, 3 years training in pediatric hematology oncology. So when I was in India, that was I think nearly about 30 years back. I trained as a pediatrician, and then I saw that children with cancer and blood problems, they were not getting the best of the care, and I saw there are no trained people. There are no this branch was non-existent. There were no doctors trained to treat or do bone marrow transplants. So I decided that I need to train, but there was no training program in India at that point of time.
Okay.
And so I decided that I will go abroad to learn this and then come back to India and do it. So I applied in UK, Canada, Australia, these three countries at that point of time. And Australia, I found a great mentor, Dr. Peter Shaw, who interviewed me. And he first selected me based on my CV and everything, and then interviewed me. And he liked that, saw the potential and my passion to come back to my country and serve my country. So he said, "Yeah, you're a right candidate. You can make a lot of difference to your country. So come and train with us, and then you can go back to your country." So yes, Sydney was a beautiful city, and it's a great children's hospital at Westmead where I trained, and I learned a lot. And I came back to India and helped patients save lives here. So going abroad was very helpful in learning a new branch, new treatment which was not available. And I'm always grateful to Australian mentors, my teachers there, my professors with whom I worked and learned a lot with them. Yeah, thank you.
So what I'm hearing is you actually made that decision because there was nowhere in India where it was available. So if it was available, you probably would have still stayed on in India and
Yes,
continued.
yes.
What we do find, especially in my side of the world, is there is a pressure, some sort of pressure to get international exposure. And so a lot of people, regardless of whether they're able to afford it or not, they put so much pressure on themselves to acquire international education. What would you say to
So,
those type of people?
yeah. So it's always your choice what you want to do. There should be some goals what you want to do. So, like, first thing when you're going abroad, you have to be very clear. You want to stay
Mm.
abroad or you want to come back. So in my case, I was very clear. I want to come back to my country. So I'm just going for learning, acquiring new skills, and coming back. Those who want to settle abroad, they obviously they are going to stay there forever. They are not looking to coming back. So their goal and aims are different. So the people who want to come back, it's a great thing to go abroad to learn new things, and coming back and bringing it to your country, especially if it's not available in your own country, then it's a great idea to go abroad. But if it's already available in your country, then possibly it's not really required, And why waste so much of money if you anyway you want to settle in your own country? So it's not a huge need. You may go for a shorter time, maybe 2 weeks, 1 month, 2 months, do a short course and do an observation, and then come back to your country. If you're already trained in that particular skills you have, some experience you may gain. So it broadens your horizon when you go abroad and meet people, see their way of working. And it like what I learned in Australia was not huge difference from India. It was maybe just 20% difference. But what I learned
Mm.
was the teamwork. That was something which I learned, that people work together and they gel like a great team. They don't have big egos. They help each other. The seniors don't behave very high headed that, oh, I'm a professor and I don't want to talk to you. And who are you? So, those sort of things. So, very friendly, good team. Team ethics are important, trusting each other. And when there is a problem, helping, following protocols. There are protocols. So, safety of the patient is the most important thing. That if something goes wrong, it has to be analyzed and fixed and corrected in future, so that it doesn't happen again. Respect to the nurses who are working with us. So a lot of things which we learned there and which helped us in our own country. So when I came back, I decided that whatever I've learned, unless I teach people and train people in India, it won't make a huge difference. I alone cannot make a difference to such a big country. So I started training programs, and I talked to the National Board of Examinations in India that we should start a fellowship, a degree program in pediatric hematology oncology. And I started teaching. And we have trained more than 60 doctors in this branch who are
Wow.
working across India and abroad in Gulf and in Australia, Canada, a lot of countries they're working, and they are saving lives just like me. And I've told them to train more people. So it's a cycle. So that's what
Yeah.
is needed in your country and other countries as well. I always tell them 1%, 1% can go far alone. But if you want
Mm.
to make a huge difference, it has to be a team. More people have to be involved. Then it becomes a movement and it can save lives, make a huge difference. So if we could do it in India, like 30 years back, we were not in great shape and things were not available. And now there is like medical tourism, people coming from across the globe for treatments to India. So it's a nice change. And that's because it started with few people like me who decided that we need to change it. And I think if I can inspire any one youngster who's listening to me, that 1% can make a lot of change and bring huge change in your country. So never think 1% doesn't matter. You can always inspire a lot of people and work, build a team, build a group, and train them and spread the message. And then things can. It's a movement. It's a momentum which you provide, and things
Yeah.
move fast. Yeah.
Yeah. Right. So for you, it's always been the heart of service. So even going abroad was to go and learn and come back, um, and not just coming back to maybe set up, but to make sure that a lot more people, get the same education that you had. So it was just really about service, for you. And I also did take away the fact that you're saying that it is good to get international exposure if the opportunity is there for you, because there were things that you learned that was not happening in your country. So it is good, but it's good to also define the goal. So if the goal is to go and come back, or to go and stay there. But Dr. Adaf is all about service. So that's really great. Yeah, so this takes me to my time in India. And each time we came to the hospital there, I always wondered to myself what great work ethic that you had. The diligence, the calm, and the way that you just handled things. For me, it's something that has left a lasting impression on me. And I just want to know, and so that other professionals can also know, what shaped that kind of work ethic.
So it's something which I probably give credit to my family for my family values and how I've been brought up. My father was in army, and army people are very disciplined. They are always on
Yeah.
time. That's the first thing they do. They're always on time. So my father and my brother was in Indian Navy. He served defense services as well. So I always found that they are always on time and proper. Then respect for people and work hard. There is no solution without, like, if you think there are no shortcuts in life, you have to put in the hard yards to do something, achieve something. So you have to work hard, being on time, and respecting people and trusting God. We have to be respect God always, and it's not that if you have saved someone's life, it's not you, it's God who has done it. You are just a way, you are just the connect between you and the patient and the God. He has given you the opportunity to heal someone, but you are not God. So we should
Yeah.
always remember that staying humble, grounded, is it's helpful, and that's what matters. And being compassionate and open to our patients, that's most important. Need to talk and explain things, because unless you explain, medicine is very complicated, very very complicated, and patients sometimes are unable to understand what's going on, what's happening. So communication is also very very important, and teamwork. You have to have a team. You need to trust each other and teach each other and discuss things. So those things are important. But yes, my family values have helped me in a great way to shape my career, and that has really inspired me to be what I am today.
Yeah, those were really great work ethics. And I do hope that the entry level and mid level career professionals listening to us now still see that it is relevant. Work ethics really matter. Being disciplined, caring, depending on the field that you're in, respect for people, that really showed up throughout the time that we were in India. We were so well treated, communicated well too. And yeah, thanks again, Dr. Adab.
Thank you.
So your field is so demanding, and even from what I saw, you were at work a lot of times. Did you ever experience burnout or fatigue?
Yes, so burnout is common in medicine, in the branch like I am, or people who work in ICUs, intensive care units. So where you see life and death very close, and so it especially when you lose a patient, it takes a heavy toll on you, on your mental health and your team's mental health, and you are we are very close to our patients for many years. Like,
Mm.
treatment is for 2 years or 3 years, and they, even after that, they're in touch for many many years. So when you are so close to a family or people whom you treated, and to lose them is like losing your close family member. So it takes heavy toll on you, definitely. And so it is medicine. Burnout is a problem, and that's why breaks are important. So even if there are small breaks, like maybe 2 3 days or 4 days, in few months time, and you can just um, be away from the hospital for some time, and be with your family and friends, and that always helpful. And having hobbies also helps. So if you follow sports, follow games, and all that helps. You're a cinema fan, or you're an art fan, you paint, you love music. So all those things help to de-stress. And good mentors, people who are always there to guide you or help you when you are stressed out. So at one point of time in my career, I thought of leaving this profession, and
Wow.
I was so burnt out, or had so much of stress in my this thing. So I talked to my mentor, Michael Stevens, and he said that just stay put. You'll be fine. Just take a break, and you'll be okay. And you don't have to leave the profession, because it would be lost to the huge community of patients who you won't be able to save. It would be a huge loss to your country if you leave the profession. So yes, that was very inspirational, and I found a huge change after that pep talk. I took a break. I was with my family, and everyone in my family inspired me that stay put. It's a great profession, great job you're doing, and just stay put. So yes, there were moments like that, and I think it comes in many doctors' careers. We are all human beings, so we have to look after ourselves, definitely.
Yeah, yeah. You definitely can't pour out of an empty cup. So you mentioned hobbies, Dr. Yadav, and I struggled to. I just see a Dr. Yadav who's busy at his desk, attending to patients. I'm very curious to know what are some of your hobbies.
So yeah, I follow sports very keenly. So cricket is something I love watching and playing. So that's something which is good. Then I watch some movies in my free time. I spend
Really?
time with my two girls, my two daughters. So they really de-stress me, and they are beautiful. So yeah. And although they are bigger now, so they don't listen that much now. But when they were younger, it was very, very nice to spend time with them. And my wife is the rock support for me throughout my journey. Without her, this all would not have been possible. So she's always there,
Oh,
stressed, and I have a lot of things to, like, I'm very upset. So she's there with me, and just she listens to me, just there to calm me down. Yeah. So yeah, these are the things which
it's
matter.
interesting to get to hear that side of Dr. Duff, because I've I've wondered, what hobby is, and all I see is Dr. Duff with, at the office, and it's quite nice to get to know this side of you. All right. Another thing that struck me in India was your team. I mean, there were times that I saw that you will be there having conversations with the team, and I've just wondered how did you build such an excellent team?
So
Are there some leadership practices that people need to know about in terms of building teams? Yeah, to the point of excellence.
absolutely, I think this is the most vital part of any profession. Unless you have a good team, you can't make a huge difference. So
Mm.
in medicine, it's even more true. And to do very complicated procedures like bone marrow transplant, which are highly, highly complicated, so you need virtually help of everybody in the hospital, all branches. It's not just one doctor, two doctors, three doctors. So first is your immediate team of doctors. So the doctors who work with you, seniors and juniors, everyone. So they have to gel and they have to trust each other. So a couple of doctors who are working with me were trained by me. They trained with me as students, and Dr. Neha and Dr. Dhwani, and so they opted to work with me. So we had a great understanding and knowing each other for a long time, and it was very smooth to work together. And then other doctors who are training with us, when we select them, we look at these qualities, that are the team people or not, and are they truthful and trustworthy.
Mm.
Rest of the things are less important because everyone is well trained, and they are all very well read and knowledgeable doctors. But being a team person is, I think, the most important. We rate it very highly when we take someone in our department who works with us. So that's a quality we look for in people, that they can work in a team, and they can then, as a mentor, I always try that the people who work with me, they progress in life, they themselves become leaders, and they train more people. And that's what I've done throughout my 25 years in this field. And I'm very proud of people who have trained with me. They're leaders themselves. And you in Africa also, when you talk about sickle and other things, you might come across some Indian doctors who might have been trained by me or would be my students if you ask them. Yeah.
Yeah, and that's true, because I have met someone who I learned was your student. Okay, so what I'm taking away is the fact that beyond the technical skills, there are other behavioral competencies or skills that you look out for as you build your high performing team. Especially collaboration. You look out for people who are able to collaborate and work well within a team, and that's part of what has contributed to the excellence that you're able to deliver. So professionals should know that you can be knowledgeable, you can be very good at what you do, but you need to have collaborative skills. Very important, and more so important within the medical field. Okay. All right. Dr. Adaf, you've stayed the course. You have been in this profession for donkey years. In a world where people are constantly pivoting, there are many doctors who have abandoned it and they're probably entrepreneurs now or doing something else. What has kept you grounded? Yeah. And do you
Yeah.
think that staying power still matters or is still relevant in today's world of work?
Excellent question and comment. So yes, a lot of people are leaving the field, not just in India, even globally in America and all the places. And there are reasons for that. So one is like sort of a burnout. Other is that people have a lot of ideas and they think that those startups can help and make a difference. So it's not bad people leaving this profession if they have ideas and startups and they can make difference, in bigger difference in people's lives. That's fine. but not everyone should leave the field, because we need good doctors, and the work has to be
Exactly.
done. So I'm very happy with what I'm doing, and every day when I see my patients, especially my patients who are long-term survivors, who finished treatment many years back, when they send a picture, a video, or text message like I've got married, or I've been blessed with a child, or something, or my younger brother who donated bone marrow is doing this, that, blah, blah, blah. So it inspires me to keep doing it, what I'm doing, and that's how I'm going. And it's very, very inspirational and satisfying to be in this
Mm.
profession. And I thank my patients and families for being there with me in this journey and keep inspiring me to do more. Those messages matter a lot, and keep sending them.
So for you, fulfillment is what matters. You are fulfilled with what you're doing. You are happy with the results that you are seeing. And more so, you are happy with the healing or the treatment that the people that you care for get. And that keeps you going. Fantastic. Fantastic. That's really good stuff. So I want to get into the subject of reward. In this part of the world where I come from in Africa, especially in my country, Nigeria, where I know doctors are not really well paid. I'm not sure what the situation is like in India. So I want to ask you, is it financially rewarding to be a doctor? Especially where it is a career that is sort of built around purpose. Is it financially rewarding?
So my principle and in my life, what my dad told me is that money never chase money. So if you do good work, money will come,
Mm,
and you will have enough money to survive. You don't need a lot of money to in life to be happy or to achieve. So there is no end to it how much money you need to be happy. So the happiness comes from within, and you should look for the small happiness in things around your life, not just in money. So I've never chased money as the main goal in my life. My passion is my patients, my profession, what I'm doing. And if you do that well, God is kind and it will take care of you. So whether you are in public hospital, in government job, as long as you are doing a good job and you are satisfied with what you're doing, then I think it's fine. And but if there are needs, like you need more money to survive or for your family and other things, obviously you will try to acquire more skills where there is more demand for a particular thing, and you will be better paid in any
yeah.
profession. That's true. So you have to acquire more skills, and if your skills are in demand, you will be financially be more rewarding. That's true in any profession. So same in medicine also. But I would just tell everyone who's listening to me that money should not be the main goal, because if you just look for money, you'll make mistakes, you'll be greedy, and that's not very, very unethical of being a doctor if you are chasing money and not doing your best for your patients.
Great nuggets there. Especially the one that jumps at me is the fact that if you do good work, money will come. If it's not coming, perhaps you need to look for a niche area that is in demand, study or do whatever it is you need to do in that area, and money will come.
Yes.
Absolutely good, good, good stuff. Thank you very much. Okay, so already we started discussing about AI and the disruption it's causing. In the medical field, you've said to us that look, it's helping you, but in other fields, there's a lot of anxiety. People are worried whether their jobs will be taken over by AI. So there's a lot of anxiety. So, drawing from what you already know, especially someone who's coming from, I mean, world class, you've got world class experience and you are already really using AI. What would you say to people or to professionals who are currently very anxious about AI?
So, like, just go back 20 years back, or 25 years back, when computers, internet was new, and emails and other things had just started. So at that time, people felt that, oh, the computers are going to take our lives. But we are still there 25 years later. Computers are helping us.
Yep.
Our lives have become much more efficient, faster. In fact, we are too much addicted to computers or mobiles and everything. That's the other part. But they are not controlling us in a way that we are controlling these gadgets, and we are using to make our life comfortable. So for AI, although like a lot of people say that the computers can diagnose a patient, can give a prescription. So there's no need of doctors. So I would say the reverse. The computers give you whatever is fed into them. So we give some
Mm,
information to computer, or there is some already information available. They analyze it and give an output. So computers can never beat human mind ever, because human mind can, what we can think and imagine is something beyond computers. So I firmly believe that that would never ever happen, that they are better than human beings. But yes, human beings are providing data to computers, and they will always keep on giving us an output based on the information we have fed. It may be right or wrong. So in medicine, even if it's 1% wrong, a lot of people can die. Eventually, like when you're flying a aeroplane, a pilot is there. Why a pilot is there? Because most planes can fly automatically, and you don't
yeah.
need a pilot to sit there. But he's sitting there just for 1% or 0.1% when things can go wrong, and he has to manually manage it. Medicine is very, very complicated, and this profession, AI can help us, make us better. The doctor can get a lot of information quickly and decide which one is better or good for his patient or not. So AI would always help us, make us better doctors, and for patients better treatment would be provided, but it won't take over our professions. And it may be something similar in other professions also. We all don't we need not panic about AI. We have to see how best to use it. Other day, one of the patients came to me, and I asked him that, how did you reach me? So this patient was from interiors of India, in a small town in India where they don't know where health facilities are available for that disorder. The child had a bone marrow failure. So he Googled,
Mm,
put it on the chat GPT, asked chat GPT, my child has bone marrow failure. What should I do? Where should I go? And chat GPT gave him an answer. Your child needs a bone marrow transplant. Go. There is a doctor available in Delhi, Dr. Satya Yadav. You can make
wow.
consult. So look at the efficiency of the AI. AI just went through the computer, whatever information available, that who are the doctors in India who treat this and what is their experience, and gave the input to the output to the patient. And then patient can decide. Otherwise, it would have taken him a long time to ask people, where should I go, whom should I go, where is the treatment available. So I'm just saying that AI would help. It will not finish things, it will help people become better. Better services will be provided. That's what I think.
Yeah. Thank you. So, I mean, there's no need to be anxious. Rather, we should understand that it's going to make us more effective and we should leverage it. I heard you say we should use it. All right. Okay. So, beyond titles, prestige, and everything that comes with somebody who is as accomplished as you are, what would you like to be remembered for?
So I just want that no child should die of cancer. That should be the goal.
Wow.
And if I can train and leave a legacy behind, more and more people are trained and they are saving lives across the areas where doctors are not available, services are not good, not just in India, even globally, across the world. So if we can train more people and pass on the skills, and they should reach all areas of the world globally, so that people don't have to travel for medical treatment to such a far off land. They should be able to get it in their own country, locally, within say a few hundred kilometers. So that should be the goal, and that's the legacy I want to leave. And India is an example where I've been one of the persons who have made a difference to my country, and I feel proud that children with cancer have a lot of doctors available now. It's still less. I'm not saying it's sufficient, but it's much, much better than what it was 25 years
It
back.
was.
And thalassemia, sickle cell disease, we are able to provide them bone marrow transplants which were not available. So it's really great. So that's what I would love, that it just the life goes on. People learn from me and do the same and keep replicating. That's the model. If you want the world to be a better place, help others, teach others, and spread. Keep it going. Thank you.
Yeah. This program was really curated for early to mid level professionals. And my last question would be, what would you like to say to people within that category who are trying to build a meaningful career?
So one tip I would give to anyone who is working, and there are always times when you get bored of a job. You always have to reinvent yourself, and every 5 to 10 years this situation comes that you have to think, what next? I've already achieved whatever I wanted to achieve. So always keep looking for acquiring more skills and learning something new. Because if you do the same thing, it's boring. Every day, same thing, getting up, doing same thing, and then sleep, and next is same. So you have to think that, okay, what next is my goal? What, how? So in medicine, there are so many diseases which we are not able to cure or provide the best possible treatment. There are certain complications which can happen, and we have no solution for those things. So research is something very close to my heart, and that's what I've done throughout my career, that providing solutions to the patient's problems. And I teach my juniors that let's analyze the data, what, how we have treated our patients, where are the problems, how we can make it better. If there's some more new research is required, new tests are required, some lab work is required, then we collaborate with our lab colleagues, even international collaboration. So I've been in touch with the top sickle people in Vanderbilt University. That's Adeola Kagho, who is there, a sickle top
Yes.
guy. He's highly inspirational guy, Vanderbilt. So I've interacted with him. He's really nice. And Professor Devon, who is the sickle father of sickle cell disease in US, and he's very inspirational. So they both are from Nigeria, I believe. A lot of people internationally I've interacted with, they've inspired me. So collaboration is important, and trying to find solutions to your problems, that keeps you going. So don't be just happy doing routine, boring work. Always look for new things, new ideas, and helping the people and make this world a better place. So in medicine, it's very, very true. Research has to be integral part of your work. You have to think of better solutions, better treatments, and don't just sit on it. Yeah. Thank you.
Yeah, thanks, Dr. Yadav. I believe what you're telling our people is reinvention is key. Continuous learning is extremely key. People should also look at continuous improvements. Whatever you're doing, keep improving it, acquire new skills. Wow, thank you so much. So,
Thank
we've
you.
had a very enriching conversation. You have shared a lot of wisdom today. And I want to thank you so much for the time on the podcast. For everyone listening, thank you so much. Please subscribe to this channel and share it with people who will find value from this conversation. So, bye bye. Thank you.
Thank you.